The earth needs our help. Our air, water, and land are polluted, and every day we can see the growing impact we're having on our environment. Thankfully, more and more people are responding, making better choices and finding new ways to clean up the planet. But what about our health and our community's health? What state are they in, and who's going to help improve them? To address these questions, the National Alliance for Hispanic Health, the nation's foremost information source and advocate for Hispanic health, launched HEAN, the Health and Environment Action Network. HEAN is a national and locally driven effort committed to securing the right of all people to clean air and water. The three pillars of HEAN are education, research, and advocacy. HEAN is working with partners in 4 communities: Salud para la Gente in Watsonville, California, Brownsville Community Health Center in Brownsville, Texas, Community Health and Social Services Center, or CHAS, in Detroit, Michigan, and the Hispanic Federation and the United Puerto Rican Organization of Sunset Park, or UPROSE, in Brooklyn, New York. At each site, HEAN volunteers are working to improve the environmental health of the places they live and play, the food they eat and the water they drink, and the air they breathe. Across the nation, problems with air and water quality are affecting individuals' health. Hispanics in particular are affected by these issues. Did you know? In 2000, 70% of U.S. Hispanics lived in areas that failed to meet air quality standards for 1 or more pollutants. Between 2006 and 2008, almost 1 in 5 Puerto Rican children in the U.S. currently had asthma. And according to the 2001 Census Bureau survey, 23.6% of U.S. Hispanic householders believed their primary water source was not safe to drink, compared to 8.8% of the general population. On a community level, all 4 local partners are facing environmental challenges. Watsonville, California is a major agricultural area known for its strawberries. But local health clinics are seeing connections between pesticide exposure in the many agricultural workers and conditions like asthma and other respiratory diseases, skin diseases, and miscarriages. Just a few miles from Brownsville, Texas, across the Mexican border, 150 factories produce electrical devices and plastics. The Brownsville Community Health Center often sees spikes in asthma complaints when the wind blows from the south where the factories are located. Detroit's Community Health and Social Services Center, or CHAS, also sits close to a border. The neighborhood that houses the clinic is less than 2 miles from the Ambassador Bridge, a major border crossing into Ontario frequented by diesel trucks that often idle in neighborhood streets. And in Brooklyn, New York, air pollution from heavy traffic in and out of Manhattan causes major concern for Sunset Park. Many residents suffer from asthma and other forms of upper respiratory disease, and the drastic shortage of public green space leaves children with few safe options for exercise and recreation. But before HEAN volunteers could help clean up the planet, they had to learn about their local air and water quality. So the first pillar of HEAN is education. At the Brownsville Community Health Center in Brownsville, Texas, youth participated in 6-week environmental summer camps, where they learned about safe air and water and did hands-on activities like making compost and planting seeds, and field trips to a recycling center, a landfill, and a water treatment plant to see firsthand how these facilities impact their community. The other HEAN sites also shared what they were learning with their communities. Some created short videos to teach the community about safer air and water.
Hey, stop right there! Don't drink that! Don't you know that water containers? You have lead, pesticides, bacteria. That water's dangerous, man. Don't drink it.
Don't listen to him, Marcus. I have scientific research here that says that this water is safe to drink. It does not have pesticides, lead, or bacteria. So go ahead, drink up.
He's got a point. Alright, let's take a sip.
The second pillar of HEAN is research, so that each community can learn more about how these environmental concerns are affecting their health. For the research portion, the Alliance worked with ScienceScope, a company in England, and Casella USA to develop EcoPacks, mobile pollution sensors and GPS devices that measure air quality. The EcoPacks monitored 4 pollutants in the air: carbon monoxide, sulfur dioxide, nitrogen dioxide, and particulate matter. Videos and still cameras helped capture other environmental concerns. Armed with the EcoPacks, HEAN volunteers spent a month testing their local air quality following a tailored research protocol developed by the Alliance and Hector Olvera, a research specialist in environmental engineering at the University of Texas at El Paso.
And what we're doing here is we're doing air collection, and we're checking for various things. We're checking for particulate matter, we're checking for CO2, SO2, NO2. And what we do is twice a week for 4 weeks, we outline a map, and we have a 1 mile by 1 mile designated area. So based on that area, we do a walking route where we have one school, one residential place, one green space, and one traffic hotspot.
After they collected air quality measurements, volunteers used Google Earth technology to plot their findings on maps of their community, so they could see exactly where pollutants were concentrated and what might be causing the high levels they found.
It shows the green, like I said, the green here, it shows parts per million. And then when it starts changing color and then getting darker, there was a lot of cars coming by here.
At the end of the month, HEAN volunteers shared their data with the Alliance and Dr. Olvera, who analyzed the findings. The final pillar of the HEAN project is advocacy, where communities take action to improve the places they live, the air they breathe, and the water they drink.
And being able to do the work ourselves and actually seeing the readings right in front of us when we're doing it is really beneficial to us as, organizers and activists. It's like saying, hey, the air is bad in our neighborhood because of the trucks, the power plants, waste transfer stations, everything in our neighborhood is adding up and our air isn't that great. But now we actually have proof.
The awareness that is created when you can show the community members a Google Earth map that has the different variations in readings versus showing them a report or quoting them numbers or statistics or percentages is invaluable.
HEAN has grabbed the attention of the Spanish and English print media and is working with federal officials and agencies to improve environmental health policy on a national level.
The rain didn't stop hundreds of people on bicycles from taking part today in Ride Your Bike to Work Day. For one nonprofit group, it's an opportunity to take Going Green to a whole new level. They are riding with a cutting-edge pollution monitoring device, and the new gadget monitors pollutants at certain locations. The National Alliance for Hispanic Health will post today's pollution level readings on its website and will continue to do more testing throughout the summer.
So what are the next steps for HEAN? How will each HEAN site apply what they've learned?
We've been pushing for a greenway, which is a pedestrian way plus a bikeway with trees and greenery around it. It's at its master plan phase now, so hopefully that gets approved soon.
I foresee that maybe might be a problem in our bridge crossings with pollution there, heightened pollution levels that might impact the health of our communities. So if that's the case, we will try to partner with our local universities, School of Public Health, others who might develop further research projects on the impact of those.
We know it won't be easy.
Addressing air pollution in itself is a huge process.
It is a very steep hill to fight environmental issues in this area.
So that we're getting the right information out to people and that we're not scaring our population, that we have the data.
It's going to be a fight just because people get so much money from the trucks and from people getting let off over here, and they're trying to expand the bridge and basically make it easier for the trucks to cut through this neighborhood. So that's always going to be an issue.
Are we going to decrease the amount of trucks that exit daily? No, we're an agricultural area. But perhaps we can increase the amount of trucks that get checked regularly.
How do you improve the quality of the air, improve the quality of the environment when 2 miles down the road, a mile down the road, six blocks down the road, you have large industrial facilities, you have hundreds and thousands of trucks passing through your community every day, and there is no end in sight.
But HEAN is an important first step that helps transform cutting-edge technology and complex data into community-friendly science. HEAN empowers individuals, and especially young people, to become the next generation of scientists and advocates working within their communities to raise awareness and address environmental concerns. Armed with education, science, and advocacy on our side, HEAN will be working to improve environmental health one community at a time.
My awareness for myself and for my family to to have a better future.
For more information and to get involved with HEAN, visit the websites of the National Alliance for Hispanic Health and HEAN at heanaction.org.